Hello and welcome to this presentation on ancillary functions of the healthcare record and its public health use. As we start to discuss the function and use of the medical record, it is important to understand the end result is to have better decision making for patient care and overall planning. We start with data to get us there. Data is defined as unprocessed facts and figures that can be organized to eventually be useful information. When data becomes organized, it then becomes information. One is not more important than the other. Data is necessary in order to validate information provided. The information cannot be gathered without the data. They both work hand in hand. A health record is first created on a patient when they are going to be seen at a healthcare facility. Let's assume this will be a hospital. The patient does not necessarily have to be physically present at the hospital for this to occur. Most often, it can even occur at a physician's office. If a patient is not feeling well and visits their physician, the physician may decide in the office that the patient needs to be admitted to the hospital. They will call or fax the patient information over to the hospital. The physician already has the demographic information and insurance information of the patient. This is the main information that will be needed to start a health record. The physician will also need to provide the reason for admission and diagnosis of the patient. Once the patient checks into the hospital, the information provided by the physician will then be verified by a member of the registration or admission department. They may also request copies of identification and insurance cards as well. If any prior lab work or radiology studies were performed, these reports can be sent as well. This will start the clinical data for the patient. Of course, patients can also present to the hospital and meet with a member of the admissions office to give the same information. All patient information will be entered into a database called an MPI or Master Patient Index. More on the MPI will come later in this presentation. After all information is entered and verified, a sheet is printed for the patient to place on the medical record or in the electronic file if the hospital has an EHR or electronic health record. There are many purposes for the health record. This slide lists a few of them. The most important purpose is to help healthcare providers with patient care. The medical record is the repository of data and information on a patient, what care was provided, and the outcome of the care. When a patient is seen in a hospital, every provider cannot see the patient all at once. They come and go at different times during the day, 24 hours a day, 7 days a week. They must record what they observe, do, and order for a patient. This allows the next provider to review what was done before their arrival. This is a continuous cycle for patients in a hospital setting. Even when visiting a patient in their office, a physician will want to see the medical record to review what the previous visit was for and what was done or given to a patient. This helps the physician to make informed decisions about care and treatment for the patient. In a hospital setting, patient care after discharge must sometimes be arranged. Some of the information collected in the medical record can be used to help facilitate this. Home health agencies, outpatient physical therapy centers, or nursing homes may need this information in order to make determinations as to whether or not their services will be needed for a patient. Clinical information can be faxed over to other facilities so they can prepare ahead of time for arrival of a patient. Insurance companies may also request information that relates to a bill they receive. Every item charged to a patient on their bill should be able to be found in the medical record as to when it was given. Insurance companies may perform an audit on the medical record to verify the charges and services performed. Healthcare providers cannot get paid if they cannot prove it was given or done to a patient. There is a long tradition of seeking improvement in the healthcare industry. Performance improvement is the key to ensuring high-quality care and great outcomes for patients. Patients have more choices now than ever as to which doctors they want to see and which hospitals they want to visit. There is a competitive market in healthcare, evident by the amount of commercials and billboards all over the country. If a healthcare organization states they are number one in their city or region, they must have the data and information to back that claim up. Most importantly, this data and information has become public knowledge. Patients can now visit various organizations, publications, and websites and view facility report cards. This makes the quality of a healthcare organization now more transparent. Would you want to have surgery at an A+ hospital or a D- hospital? Or at a low-scoring hospital or a high-scoring one? This transparency is causing all healthcare organizations to ask themselves, how can we do things better than we already are? As an example of quality, the Joint Commission has a comparison of a provider's performance based on core measures of some common diagnoses contained on this slide, the purpose of which is to define the best practices that achieve the best outcomes for each condition. Hospitals can view their results after they are analyzed and see how they compare to other hospitals. This helps them to identify what they can improve upon. As an example, for MI, which is heart attack, or acute myocardial infarction, they measure if aspirin was given to a patient upon arrival, if aspirin and a statin medication was prescribed at discharge, if they were counseled, if the patient was a smoker, counseled to help them stop smoking, if fibrinolysis was received within 30 minutes of arrival. Those are special drugs to help break up blood clots, just to name a few. Hospitals must extract this information from the medical record in order to provide it to the Joint Commission. A Quality Improvement Organization, or QIO, helps the Centers for Medicare and Medicaid Services, CMS, to perform quality functions. There is a QIO located in each state. They work on behalf of CMS, so healthcare organizations must follow their requests as they would if CMS contacted them directly. The core functions of a QIO are listed on this slide. The term performance improvement has many names. They all mean the same thing: monitoring and evaluating the quality and appropriateness of patient care, measuring processes and outcomes, conducting trend analyses, and developing standards for high-quality patient care. You will see these terms mentioned interchangeably in the healthcare industry and maybe even in other courses with the university. Case managers have an important function in the hospital. We mentioned previously they initiate aftercare for patients that are discharged from the hospital, but they also monitor the appropriateness of patient admissions to a hospital. They work very closely with the physicians and insurance companies to ensure the hospital will receive payment for a patient's hospital stay. They review for what we call medical necessity for a patient admission. They determine if it is medically necessary for a patient to receive inpatient hospital services. On a smaller scale, they also monitor patients that have outpatient surgery as well. UR utilization review or utilization management, case management is all the same department. They just have different names, as in performance improvement. What is also important to know is CMS requires a healthcare facility to have this department. It is spelled out in the Medicare Conditions of Participation for hospitals. Any hospital that accepts care patients must follow the conditions of participation. Although a main purpose of the medical record is to provide patient care, it is just as important for a hospital and providers to get paid. Without the reimbursement from insurance companies, hospitals would not exist. As mentioned in a previous slide, the medical record must show support for each and every item and service given to a patient. At any time, a patient or insurance company can request a copy of a hospital bill and medical record to validate charges. Some healthcare facilities choose to go through a voluntary process to earn accreditation with an organization. As stated, this is totally voluntary. The accreditation organization has standards to which a facility must reach. They then go through a survey process that validates the standards are being met. The slides show some of the accreditation organizations we commonly hear about. Licensure is different from accreditation. It is not voluntary. State laws determine who must be licensed to perform certain services, including hospitals. There are standards or laws that must be followed according to each state. Certification may or may not be required. It depends on the organization responsible for awarding the certification. You normally hear of certification when discussing professions in healthcare. There are certain professions that have certification exams that show an individual is very knowledgeable in a certain area of healthcare. There are many certifications in all levels of healthcare professions. It is important to understand how medical staff members become allowed to see patients in a hospital. They go through a process called credentialing. This is where a background check is performed to verify their education and credentials. A physician must apply to be able to see patients at a hospital. Their application then goes through the credentialing process. The hospital will verify they in fact graduated from medical school and they took and passed the state board. Passing the state board is required in order to learn a license to practice medicine. A legal background check is also performed to see if there are any judgments out against a physician or if they have lost their license. After the credentialing process is completed and everything checks out okay, the physician will be given privileges or permission to practice medicine in a hospital or healthcare facility. The hospital or healthcare facility will then verify the physician on a routine basis, normally every 2 to 3 years. The health record can also be used for legal matters and may need to be used or admissible in a court of law. The medical record or the Health Information Management Department in a hospital takes care of this process when a medical record is requested for legal purposes. That process is called ROI, or Release of Information. Since the health record is the property of the hospital or healthcare facility, normally the original record is kept on site and copies of the medical record may be sent out to a judge or attorney. Vital statistics are records that are kept permanently. They include records of births, deaths, marriage, and divorce. Vital records are normally first created at a local county office and then filed permanently at the National Office of Vital Statistics. The Centers for Disease Control and Prevention, or CDC, works in conjunction with the Vital Statistics Office. Vital statistics are collected on standardized forms. This standardization makes it easier to compile the data that is given. We previously discussed the creation of the medical record. It is just as important to know about the destruction of medical records. Medical records are only released with the patient's permission, unless the record is being released for treatment, payment, or operations. The patient must sign an authorization form when they need copies of their own records. Each healthcare facility must define how long they will keep their medical records beyond state law. Each state provides their required retention law for medical records. After the state law time frame has expired, records can then be destroyed. They must be destroyed in a way that makes them unreadable. Due to privacy laws, records cannot be thrown out in the regular trash. They must be shredded, burned, or pulverized so the information contained in them cannot be read. Facilities must have policies and procedures to address how long they will keep medical records, when they can be destroyed, and how they will be destroyed. A certificate of destruction is a form that is a great way to record when and how records are destroyed. Companies that destroy records for healthcare facilities can provide this type of. As mentioned earlier in this presentation, there are many uses of the medical record to include research and public reporting. When new drugs and devices are approved for use in clinical trials, it is the medical record that contains this documentation. As mentioned before with vital statistics, this is a form of public health reporting, along with patients that have communicable diseases that the CDC may track, for example. Healthcare facilities keep their own indexes and databases of their own data and information. This slide mentions a few of them. The MPI is the Master Patient Index, or a listing of all patients that have ever been seen at a facility. This is how patients are created if they are brand new to a facility, and how they are found if they have been there before and already have an assigned medical record. This slide shows a snapshot of an actual MPI. You can see the necessary data fields that help to identify a patient. The information can be updated as necessary. The MPI in a healthcare facility is kept permanently. That means it is never destroyed. It is considered vital in a facility as well. This is how previous records are also retrieved. The medical record is always the primary data source. This is the main location to find specific information on a patient. It documents all care given. A facility may compile secondary data that will not identify a patient. For example, a hospital may want to know how many children they treated with asthma during a certain period of time. This report will not identify the names of the children, just the total or the amount of children. This is also called gathering aggregate data. This concludes this presentation. Thank you.